Good day, everyone. We're going to make a quick video updating you on your study planner journal. So if you are following me and you're doing management of care this week and next week, this is going to help you do your daily and prepare for your daily plan. All right, and I did it a little general. I didn't go through and do the hours. So if this particular planner I have doesn't give me enough space to really break down the hours, but what you could do is just take your notebook. So you should have a good notebook, maybe one thicker than this. This is just a one subject notebook. You may want to get one that's thick enough to do like 5 subjects, and just write your day up here. And each line, what time you're going to get up, 8 o'clock, what I'm going to do, and what times am I going to be studying, and what is my plan for that study. You can actually do it for the whole day, what you do at 8, what you do at 9, what time I'm going to take my lunch, what times I'm going to be working. You can do it that way, or you can just put in, hey, on Monday I am going to study from 9 to 12, and that's my 3 hours. And then you want to account for your breaks. So you may go over 12 because you may need like a 20-minute, 20-minute break in between. All right, so make sure you have your supplies. You got your planner, you got your notebook, you got plenty of pens. I'm recommending just getting some simple color pens or pencils. Excuse my nails, I got to get them redone. But these I got from Dollar Tree, and I got some pencils as well. The pencils don't show up on here that well, but I think they'll do great on your notebooks. All right, so management of care this week, I went ahead and just filled in. So if you did Sunday, and let's say you did some questions on Sunday, you can add in what you actually did. So you could just take a little small space and say, hey, I did 20 questions. So Sunday we wrote content down, or 30 questions, because that's what I'm recommending. So let's say we did checkbox. We did 30 questions, and we reviewed each of those questions. Now, when you're going back to review questions, you want to make sure you understand why you got the answer right or wrong. You don't want to just memorize the question and say, oh, I know those answers, so it's not helping me. Even if you've gotten a question that you've seen before, what you want to do now is look at that question and think about the testing strategy in that question. Was there a comparable or a like option to eliminate? Was there an abnormal option to eliminate? Was there a positive versus a negative that you had to eliminate because you were looking for a positive? So look at how the question was presented, and not just the content that was in the question, not just memorizing that and that, yeah, this was the answer and I just know that question, but start looking at, well, why is that the answer? And why were the other options not the answer? That way you're breaking down the information. Talk it out loud, and understand why the answer was correct and why the other answers are incorrect. That will further increase your knowledge, so that when you get a similar type of question, you're not missing the same content over and over. I get so many clients that say, hey, I did 1,000 questions and I already know all those questions. Well, if you know it, you'll know how to explain it back to me, and you'll know how to answer that question if you got a similar question. And Nclex is just going to give you the same kinds of questions. They're just going to mix up the answers. They're going to reword it. It's the same type of information, at least. And if you really understand that information, you'll get the answers right. So there's still something you're missing if you're doing thousands of questions and you're still getting questions incorrect. You're missing the information, and you're probably not utilizing the testing strategies. So start studying based upon the testing strategies. And those testing strategies I will teach you during your tutor session. So just reach out to me for your tutor session. All right, so you would check off everything. So if you went to Saunders and you read about your advanced directives, there's not a lot in there about time management, so I can give you some key points on what things to know about time management. So let's say you got your notes on that, as well as cost-effective care. I have questions that talk about time management and cost-effective care. So when you're answering questions, you want to choose an answer that is most cost-effective and that is dealing with time management. Nclex likes you to do things in order that if you do one thing, you don't have to do the next step if you find out. So if I know the patient doesn't want to consent to a procedure, why go and check labs and get him prepared for the procedure if he doesn't want the procedure? But if I even know that he wants it, and then I know it's not safe for him to get the procedure because maybe his coags are out of whack, then why even go through the process of getting him prepared any further? So that's doing your time management. You do one step in order to prevent from having to do all these unnecessary steps. Delegation. There's a lot in Saunders about delegating what things are in the scope of practice for the LPN, as well as the your staff nurses, your RNs who are floating, how to choose who to delegate to them, float nurses, nurses that are coming from other specialties. Also, your UAPs. So you want to make sure you have a grasp of knowledge and read over that content. Let's say we did 30 questions and review that. Yesterday, what we're going to go back and do is check off what we did. So let's say Monday you did your 20 questions. Now, if you're doing management of care this week, I may have sent you through Google Forms the 40 questions. So I sent a set of 20, and I think I just sent out another set of 20 to some of my clients. Let's say you got the question wrong about urosepsis. That will be content you need to review. So I'm going to show you how to do that. All right, then let's say yesterday you needed to do Saunders, 13 questions, because we said on Monday we were going to do 30 questions content. Okay, I'm thinking about the ear and eye. So there's 13 questions in Saunders that deal with legal, ethical. If you still have the 8th edition, go ahead and try to get that 9th edition. In the 8th edition, ethical and legal issues is chapter 6, and there's 13 questions. So let's say you did that, and they may be repeat questions, but review that information that's in the book, review that outline, understand it. And this time when you look at the questions, read through the rationales and understand the testing strategies that they're trying to explain to you, because there might be easy questions, but those strategies are going to help you answer harder questions. All right, plan of care. So now we're going to bullet the next four things that we're going to do on the NCSBN outline. And that is plan of care, how to initiate, evaluate, and update the plan of care. All right, so Monday we should have done that. We should have done education. We should be reviewing how to provide education to clients and staff about client rights and responsibilities. In the legal section chapter in Saunders, there is information about the patient rights and how to advocate for their rights. Okay, and so I think that's the next section. Advocate for client rights and needs. Okay, and then we need to know what's everybody else's job, and how am I going to collaborate with the healthcare team. So you're going to collaborate with multidisciplinary team members when providing client care. So I need to understand what the physical therapist does, what a nutritionist does, what the social worker does. Okay, so if you reviewed all that, you check that off, and you're saying that, yeah, I did review this, I understand, and I'm ready to move on to Tuesday. Sometimes you may have to carry something over from the previous day to the next day if you didn't finish everything. All right, and so today you're going to do the next 4 bullets, which is manage conflict among clients and healthcare. Okay, and a lot of times this is just, you're going to have to do questions on management of care to understand what are they going to ask me. But there may be some limited information in Saunders about how you're going to manage staff. Usually when you're managing staff, you want to do ADPI. You want to assess first, figure out what the problem is, what the diagnosis is, plan how to fix the problem, implement and intervene, and then go back and evaluate and see did that work. You want to understand SBAR. There is information in Saunders about handoff, SBAR, how to provide and how to receive a report. And then HIPAA, I've talked about HIPAA a lot. So you want to be able to maintain client confidentiality and privacy. And what would you do if it has been violated? How to report it? How to, write out an incident report. There's questions I've gotten on management of care about that. Documentation and terminology. There is a section in Saunders that goes over documentation, and it tells you what terms you want to use, what things you should write in your documentation and what things you should not write. And then questions, we want to do again another 30 questions from management of care, or it can come out of Saunders in these sections. Okay, so we're focusing on that. So let's look at this question about urosepsis, and I'm going to show you what you should do when you get a question that you get incorrect, how you should be going back and making your notes and studying. Okay. So we're going to look at that in just a minute here. This is the NCSBN test plan again. You may not be able to see it that well, but it is on their website. If you're studying with me, you should have this when you get to this category. So this is where we got those bullets. And so we're doing 4 a day because I counted the bullets. There was 24. So 4 a day would give you 6 days of things to do. And so I went ahead and wrote it out for Wednesday, Thursday, and Friday. Each of these have 4 bullets. And we already did Tuesday, Monday, Sunday. Okay. So now we're down to, what was the last one for Tuesday? Documentation. So use approved terminology when documenting care. That's where we are. So the rest of the bullets will be completed throughout the week. The other thing you want to look at on the outline, and this is just my own personal outline for management of care. What I do is, continue studying 2 to 3 hours a day. You're going to do leadership and management questions. Make sure you've completed the information. Go back and review that information in Saunders. Skin, ear, and eye conditions, I put on to do that on Wednesday. So Wednesday, we're going to add that into our topics as well as the bullets. Okay. So, and then another 30 questions. So you want to try to complete as much of that as you can. Content, I put Thursday, we're going to do content, and Friday, case studies, 10 case studies, and maybe about 20 more management of care questions. So you're getting your 30 questions minimal. Saturday was my rest and relax day. All right, so ear and eye conditions, be sure to incorporate in your questions using any of these process of elimination, any of these testing strategies. Okay. Now, let's go into the question. All right, so here's a question you don't want to miss. I'm going to make it a little bigger. All right. The nurse is performing discharge teaching. So this covers one part of Monday's bullet. Educate, let's see, that's educating responsibilities and rights. Plan of care. Initiate, evaluate, update the patient on the plan of care. It is dealing with education. I think there may be another bullet about education. This was only educating about rights and responsibilities. But our subject here is a patient with urosepsis. So if I admitted a patient with urosepsis, I need to know, what am I going to teach them? What's going to be on their plan of care? All right, so we're doing this question number 6. Which statement by the client would indicate the need for further teaching? So first, your case event is an older patient that came in with urosepsis. I need to understand that urosepsis is similar to a patient who's continuing to have UTIs. The urinary tract is infected. They're developing sepsis because of this urinary tract infection. And that may be explained in Saunders. I think they have a section called, in the renal chapter, cystitis and urinary tract infections. Then they also have urethritis and ureteritis. All of that can be part of the urosepsis, as part of the urinary tract. So you want to read those sections in Saunders. So again, in your renal and urinary problems of the adult client chapter, read through cystitis, urethritis, and ureteritis. All right, all that part of the urinary tract. So that's including urosepsis. So we know it's urinary, and we know it's sepsis dealing with the urinary tract. So this is an infection. What am I going to teach the patient? And the question is, that was our case event. Our query is, what statement by the client would indicate the need for further teaching? When you see a question that asks you for a need for further teaching, you need to be looking for a negative answer. So we're going to eliminate anything that is positive and that helps the patient. Sometimes all things might be positive. Then you need to start eliminating things that are most positive, that really truly helps, and get down to the most negative things that really don't help the patient. All right, so option A, I will continue to take my prescribed antibiotics even if I feel better. That is a true statement. That is a positive statement. Anytime a patient has any infection, not just urosepsis, we need to teach them that continue to take your antibiotics until the full course is done as prescribed. That's true. So we're going to eliminate that. So if I had a mark, if I could cross that out, I can on this screen. But if I can cross that out, I would cross A out because that is a positive statement. I'm looking for a negative. Need further teaching. I will drink 1 glass of apple juice a day. Okay, that doesn't sound too bad. I don't know how apple juice is really going to help somebody to drink apple juice every day. So that's questionable. If I could write out here, I would put a question mark and come back to it. Not going to eliminate it right away. It doesn't seem helpful, but it doesn't seem all that negative either. All right, C. I will monitor my temperature for signs of a fever. Well, what is an infection? An infection, signs and symptoms of an infection that is getting worse or that is not being treated appropriately is the patient will continue to have a fever. All right, when I had COVID, I had fever for 2 weeks straight, right? Because COVID was still rampant in my body. And for anybody with any infection, once they start developing a fever, once we can treat the infection, the fever should start to subside. So if they're monitoring their fever, that's great because it tells them that, hey, I'm getting rid of the infection, my fever is getting better, it's not coming back, and we don't want them to sit with high fevers, right? We want to be able to treat the symptoms and treat the underlying problem. So we can eliminate C. A and C are both very helpful for anyone with an infection, not just urosepsis. So you generalize this information. So on any question, if they changed that and said he was admitted with pneumonia, A and C would still be appropriate things to do. Now, urosepsis, there may be some teaching that we would do specifically for the urinary tract that you won't do with pneumonia because we're dealing with the renal system and not the respiratory system. All right. D, I will make sure that I void when I feel the urge. Yes, I don't want my patient holding their urine because holding it in urinary retention can increase the risk of an infection. And it doesn't help them if they don't urinate when they feel like they need to go. All right, and we will teach them. It may be kind of more frequent in the beginning until they get rid of that infection, flush it out. So they need to drink a lot of fluid. So I would think of other positive things. If I was making notes on this question, I would write in my notebook, urosepsis, highlight and put that at the top and write down signs and symptoms. What are the treatments? What are the nursing interventions? What are things that are going to help this patient? What are things that don't help the patient? What are things that they should avoid doing? So you want to have that in your notebook if you missed this question. All right, so we're down to either, we're left with only B because I don't want him to do D. So if he makes sure that he voids, that's good. Taking his fever is good for anybody with an infection. Finishing your antibiotics is good. B, do your clinical reasoning. Ask yourself, how does apple juice help? If he drinks apple juice every day, what does that do for the patient? And there's really nothing I can think of. Now, you will have some vitamin C in apple juice, but there's other ways that he can get vitamin C into his body. So what is least helpful? If he says he's going to drink apple juice every day, that is the least helpful thing for anyone with an infection, specifically the urinary tract. If you're trying to increase fluids in a patient with a urinary tract infection, just think about what fluids they should drink. Number one, water. Water is probably the best drink. What else should we do? So if you go to Saunders and let's see if I can pull that over. 1 second, I'm going to pull this down. And you see my little snacks there that I have. Let's see if we can focus in a little bit on. All right, so interventions. Let me slide this over to interventions. If you truly read through Saunders and understand this information, we know that we need to increase fluids, 3 liters a day for a patient who has cystitis or urinary tract infections, especially if they're taking antibiotics like sulfonamides, because they can form crystals in the urine. You want to flush the urinary tract out. Administer prescribed medications, right? We talked about that. Now, here's a key point. Number 4, maintain an acid urine pH. Urine is normally acidic. It has a pH of 5.5. We need to instruct the patient about foods to consume to maintain an acidic urine. Well, apple juice is not acidic. It's a very mild, soft kind of drink. It's not acidic at all. What things are acidic? Now, they really don't say, they don't give us a list here. So if you have to go to food and nutrition and find out what foods are acidic. But if you can remember that your number one fluid for urinary tract infections is cranberry. Why do we give patients cranberry juice? Cranberry is very acidic, and it will help keep the urinary tract acidic, and bacteria is less likely to form and to develop an infection there when the environment is very acidic. They don't like acidic environment. So cranberry juice is what that should say, not apple juice. Cranberry juice. All right, so medications that decrease, let's see, these medications are decreased by acidic urine. So if they're on these types of antibiotics, the actions of these meds are decreased by acidic urine. So their question there wasn't talking about what type of antibiotic they were on, but we do have to keep in mind that these antibiotics need a less acidic environment. But overall, acidic urine is going to be good in preventing infections and in treating that infection. Use sterile technique if they have a catheter. Discourage what type of products? Caffeine, cola, tea, coffee. It's going to make them pee more. All right. So a good nursing 101 book, if anyone ever says, what book should I read? Nursing Fundamentals. It talks about nutrition a little more in detail. You can go to the nutrition section in Saunders and they'll give some information, but it would go over more of what caffeine, coffee, tea, and cola does for the urinary tract. We know it's more of a diuretic because that's what caffeine does, right? It makes you pee more. Avoid alcohol. Take their meds. Repeat urine cultures. Prevent the recurrence of cystitis. Take their antibiotics. All right, and then they go over more about urethritis. And then on the next page, urethritis and what types of antibiotics they use to treat that. So cranberry juice, write that in your notes, right? So this was something that you may not find all the information in there, but basic nursing, 101 nursing, you should never forget that cranberry juice is good for the urinary tract system. I want to see if we can find any information on nutrition in here. But take time to look that up and see if you can find that. It's kind of like, studying. Studying is like teaching. You're teaching yourself, you're studying, you're reading the information, and you just need a tutor to help guide you to understand information that you may not be able to pull out of this book or out of whatever resource you have or out of whatever question. So that's a question you don't want to miss because it's basic nursing knowledge that cranberry juice is good for the urinary tract. All right, so this particular book, this particular edition doesn't have a whole lot on, they talk about diets, but I don't see anything about just acidic foods, but your fundamentals books will have it. All right, so let's switch back over here. You see my book is like tearing apart. All right, give me 1 second. All right, so we're going to finish up here. So the best choice that says they need further teaching is the most negative answer. We are going to teach them to drink cranberry juice every day and not apple juice. Apple juice really is not as beneficial when it comes to urosepsis. Okay, so that's what you should be doing as you're coming across questions and you find that you get them incorrect. Use that testing strategy. We use positive versus negative. All right, and so the rest of today, we can check that off now that we reviewed urosepsis. We did our 20 questions. If you did your management of care, 20 questions, plus the 13 in Saunders will give you 33 questions. So you did your 30 minimal. And if you went over all that information with plan of care, educating, go through that section in Saunders under ethical and legal and leadership, then you're done for Monday. You've done your 3 hours and you learned a key thing in urosepsis, and that is going to apply to a lot of different questions, how to use that testing strategy. So that was Monday. Tuesday, go back. You should be doing managing conflict, HIPAA, documentation, SBAR. Do your 30 questions. And if there's any question that you get incorrect, you're going to do the same thing that you did for this last question, where you make your notes on it and understand what's the testing strategy. What are they asking? What's the case event? What's the query? Why did I get it incorrect? How could I have reasoned through that answer? And then we'll follow up with Wednesday, Thursday, and Friday. All right, so that's going to conclude our session for today. I hope you've enjoyed it. I am going to be trying to upload on Teachable and probably on my website as well some paid sessions that you can go in and just take on your own time that are going to include management of care and how to break down that information, and we'll be going over some questions. So that's going to come in due time. Probably won't be this week. I got kind of a full load this week, but I hope you're doing well. Continue to do your study planner journal. It will help guide you. It will help you to see what you're missing, what you're studying, what you're not studying. Okay, and continue to have your notebook to the side to write down your notes. As you're doing questions, when you find something that you're not understanding, write it down. Have your notebook to the side and write that down so you can go back and look it up and review it. All right, I hope you have a blessed and wonderful day, and I'll see you in the next video.